education delivered by Caribbean and African doctors. These health hours are all about empowering, educating and giving space to black people so our communities can look after themselves better. Every Saturday, our black GPs or consultants present on those health and well-being topics that affect you, your family members and friends. Some weeks will such as pharmacists, specialist nurses and faith leaders. Our health hours cover a range of topics and include mental health, heart health, women's health, reproductive and sexual health issues, men's health, respiratory problems, cancer, sickle cell and many more. We have not forgotten to include within our health hours the many societal, cultural, religious and racial challenges that can go hand in hand with health problems and influence how we should respond to meet health and well-being needs. The sessions are designed for you and we want you to use the time to listen, learn, share your experiences and ask questions to our black doctors. During every session, we will gather your feedback so we can continue to respond to the needs of our black community. To request any particular topic, please email health@can.org.uk. We encourage you to invite to health hour sessions. Spread the word in our community. CATHIB is funded by the National Lottery Community Fund.
Hello everyone, my name's Kemi and I'm going to be hosting today. So I just want to say welcome to everybody who's on the Zoom and on YouTube and on LinkedIn and Facebook as well. So thanks for coming in and joining us today. So CATIP is a forum and an organisation where we'd be able to improve health literacy within our community. And we've got a great talk ahead of us that's focused on sexual health. Just want to let everyone know that there's going to be a question and answer part of this session. So if you want to put your questions into the chat, whether it's on YouTube, LinkedIn, Facebook, or on Zoom, so the chat's going to be monitored and would be able to pull them up at the end. And as well as going to be like a chance for you to ask questions directly. So if you're willing to do that at the end, keep your questions and we've got some time for that. Just want to let you know that this talk is going to be on sexual health and we've got an amazing talk by Dr. Dornubari Lebari, who is a consultant in sexual health and a GP as well. So we've got a really insightful and interactive talk ahead of us. So I'm going to hand over to Dr. Dornu and she's going to be leading us on this interesting talk. So thank you.
Right. Hello, everybody. Thank you for taking time out of your Saturdays to listen to me talk about sexual health. I talk a lot about sexual health. I work in sexual health half the time, half my week. And then I also work as a GP. And even while I'm in GP, usually I've got my sexual health head on. So obviously trying to always keep sexual health at the forefront. Now, before I start, I will just say this really quickly. I don't want to offend anybody, so don't be offended by anything I say. A lot of my talk, because also I just want to sort of give you the information and let you digest the information. I've tried to simplify it, and in doing so, I will be using binary definitions for gender. So because we're going to be talking about genitals essentially. So when I talk about, if I say men, I mean anyone who has male genitals. So that's not necessarily about how they might identify. If I say women, I just mean somebody who was assigned female at birth as well. So female genitalia. So just take it with a pinch of salt. It's just a lot smoother. It's not because I'm lazy, it's just a lot easier rather than having to explain it as we go along. And I hope that's okay. You can beat me up later if that offends anybody. Okay, so let's get on this one. So let's talk about sexual health. So this is me. I am on what used to be Twitter, now X, whatever that is. So what I'm hoping that we can cover today, she says. So hopefully we can cover what is sexual health, We'll cover some STIs. I'm not going to be able to cover obviously every single STI possible. That will need at least, I don't know, about a year. Definitely at least a week. So I'm just going to cover the ones that are relevant or ones that I think people should know about, because maybe there's not as much information out there, or what information is out there is very scant, and there's a lot of myths and people probably don't know what the real lie of the land is. Obviously, I'm going to cover ones that are really important when it comes to Black African and Caribbean communities. And then I'm also going to talk about the role of genital skin health. I'm going to cover a little update about HIV, which I think is really, really exciting, hopefully, for some of you. I know that sounds weird. And then more importantly, I think it's really important that we know where to go for help when it comes to sexual health. And then obviously question and answer at the end. Oh yeah, part of this, I'll be using Mentimeter for some votes. So if you can go to menti.com, I think it's in the chat, is that right? If you go to menti.com and the code is, somebody got the code? I don't remember my own code. But we're going to be using Mentimeter to answer some questions, or for some audience participation. It's really just to get a gauge on where people are. It's not to vilify or tell anybody off or anything. So just feel free and just answer as honestly as you can. So let's start. So what is sexual health? Well, sexual health is, when I ask people this, or when I have asked people this in the past, you get very varied responses, because I think it means different things to different people. And I don't think there is really a clear definition. What does it mean to be healthy with regards to sex or sexuality? And really, when I have asked people, you probably get a bit of this word salad that you can see here on the screen. There is actually a definition from the WHO. I'm not going to say it's my favorite definition, but it is a definition of some sort that we can sort of at least start from. So according to the current working definition by the World Health Organization, sexual health is a state of physical, emotional, mental, and social well-being in relation to sexuality. It is not merely the absence of disease or dysfunction or infirmity. It goes on to say sexual health requires a positive and respectful approach to sexuality and sexual well-being. And sexual relationships, as well as the possibility of having pleasurable and safe sexual experiences, which should be free from coercion, discrimination, and violence. And lastly, it says, for sexual health to be attained and maintained, the sexual rights of all persons must be respected, protected, and fulfilled. So I just want you to think about that for a minute, because there's a lot in there, isn't there? There's the fact of it's not just the physical, it's the emotional, the mental, and the social well-being. The second part of that comes from just the WHO's general definition of what health is, which is it's not just absence of disease, dysfunction, or infirmity. So one of the things that I talk to a lot of people about, both in the Black community, but definitely in the Muslim community as well, in case you can't tell I'm Muslim, is about talking more about sexual health, and with a positive and a respectful approach. Because I don't think we talk about it enough in that sense, and I don't think we talk about it in the right way. Okay, now for some audience participation, shall we say. So if we go to Menti, now this worked nicely before, so let's hope it will again. And yeah. So first question, I guess, for the audience, there's the code for Mentimeter, menti.com, use the code 5744027. Have you ever in your life had a sexual health screen? Someone's already put in the chat about pregnant ladies. Pregnant, if you have ever been pregnant, then you have, well, you haven't had a full STI, sexual health screen, but you've had a HIV test, yes. So pregnant women get bloodborne virus screening. I'm just gone quiet just whilst you answer. I'm sure there's more people than that can answer, so I'm just giving you guys time to catch up. So what is a sexual health screen? So I guess, yeah, it depends what you define as a sexual health screen, because you could define a sexual health screen. I mean, we define it in sexual health as if you've ever had tests. It doesn't have to be at a sexual health clinic, by the way. It could be at home. It could be through GP. It could be through a private GP or private sexual health services or specialist sexual health services. And it usually involves a minimum of 4 tests: gonorrhea, chlamydia, syphilis, and HIV. So if you've had 4 of those tests, that's the minimum that would qualify as a sexual health screen. It's at any point in your life. Okay. The Mentimeter is still going on, so you can still answer. Don't worry. But I'm just moving on to this. Okay. So why am I even talking about sexual health in this forum? I mean, I've already alluded to it a little bit, because I said, you know, we probably don't talk about it enough in some of our communities. And I'm going to start with this because I know most of you probably, when you heard the title, probably do want to know about sexually transmitted infections. And whilst a large portion of today will be me talking about sexually transmitted infections, that's not the only thing we're going to cover. So if you look at this slide, this is data taken from the last complete set of data we have to date, the 2022 STI diagnosis in England, people resident in England. So this is not about any immigration status, it's just anybody resident in England who have accessed, sexual health services. Sorry about that. Who have accessed sexual health services by their own self-defined ethnicity, okay? And if you look closely, no matter which STI diagnosis you look at, whether it be chlamydia, that's the first one, dark blue, then, sorry about that, then gonorrhea next, then syphilis, genital herpes is this one, genital warts is that one, and trichomoniasis is that one. No matter which one you look at, then those of Black African, Black Caribbean, other Black or mixed ethnicity come out as having higher rates over the background white population. Now, the thing to bear in mind is these are rates I'm showing you. So actually it is significant because of all the people who test for STI diagnoses, Black African and Black Caribbean only make up 9%. So even in that small cohort, we're finding that the people who are testing, they're more likely to be positive for these infections if they're of this ethnicity. And this is not across the board for the ethnic minorities, and it is something unique to those of the Black ethnicity, because if you look at Asians or this one other, which basically encompasses Arabs as well as whoever else, Eastern Europeans, etc., it's actually relatively low compared to what Black people of Black ethnicity have. So to me, this speaks that there's clearly a problem in our community. Where the problem lies, I think it's multifactorial, and I think, and I hope this is shocking for you as it was for me when I first got into sexual health, but this data has not changed very much over the 20 years I've been working in sexual health, unfortunately. And so it tells me that there's lots more we can do. There's actually been a study to look at the why, as in why is it that people of Black ethnicity are the ones with more STI diagnosis or higher rate of STI diagnosis. And actually the conclusion, I think, of that study showed that there wasn't anything specifically behavioral or cultural. But I disagree, because I do think part of it is we don't know. And the reason we don't know is because we don't talk about it. Definitely if you're Black and Muslim, it's like you don't even mention it. We all pretend it doesn't happen. But the fact that we all exist is testament to at least 2 people in this world having sex. So it does happen. We probably need to talk about it more in a healthier way within the context of our culture. It doesn't need to be degrading, or it doesn't need to be in the sort of, what's the word? Sort of open, flagrant way that it is in a lot of societies. It can be done well, but we do need to be doing it in some shape or form, because not knowing and not talking is harming us. Okay, so let's talk about sexually transmitted infections. That's what you came to hear about. So that's what I'm going to talk about. And the first one that I'm going to talk about is the one that is almost exclusively seen in the Black community. And when it isn't seen in the Black community, you can still trace it back to somebody who's Black. So Trichomonas vaginalis. So this is an infection with a parasite named Trichomonas vaginalis. And the reason it was named that is because they first found it in vaginas. I remember one of my earlier mentors used to say to me, men carry this infection and they pass it from vagina to vagina, because less men seem to present to the sexual health clinic with this. It doesn't mean they're not affected. It just means they just might not present. Now, with this infection, only half of people will get symptoms, whether they have male or female genitalia. The video you're seeing is a microscopic video of what trichomonas looks like. So when we look for trichomonas under the microscope, this is what you look for. You look for these little parasites that are literally wiggling and moving, and they are microscopic. And the presence of them signifies, from whether it's a swab you've taken or a man's urine, tells you this person has trichomonas in their genital tract. So what are the symptoms? Well, remember I said whether male or female, the chance of symptoms is only 50%. And if women do get symptoms, it's not very specific. It's mostly going to be things like vaginal discharge, vulval irritation or itching, pain when passing urine. And if men get symptoms, then you'd be, they'd get scanty sort of penile discharge, and they might get some pain when they're peeing. Compared to other STIs, the discharge men might get with this one is usually quite small or moderate at most. And so why are we even talking about trichomonas? Why am I even talking about trichomonas, apart from the fact that it's almost exclusively seen in the Black community? Well, there are complications with it, and the complications are far-reaching. We know that if a woman gets pregnant and she's got trichomonas, or she acquires it when she is pregnant, it's associated with preterm delivery and low birth weight, which obviously has implications for the health of the baby, both in the short and the long term. We know that preterm delivery carries a higher risk of death for the baby if they're born too early, or the list of potential complications are just too numerous to list. We also know that there's a clear link with kids that are born preterm having a much higher risk of hypertension later on in life, another thing that's quite prevalent in our community. Also, there's a clear association that hasn't been disproven despite the progress made with HIV diagnosis and treatment, but there's still a clear association between having trichomonas infection, in that having this infection in the genitals increases the risk of acquiring HIV more than any other STI. And so, but interestingly, this infection is one of the easiest to treat. You just need 7 days of an antibiotic called metronidazole. Yes, that's the only one that that's the main one that at the moment you can't drink alcohol with, because it makes you violently sick if you have alcohol on board with it. So again, if somebody is dependent on alcohol, I usually say try and be open about this if you need treatment for this infection, so that we can work out what's best for you. And if you go and see your healthcare professional, try and be open about it so that they know. because there's no point just trying to make yourself sick if you need to take treatment. I think it's a lot easier if it's a woman, because sometimes we can do other alternative things, but even in a man's case. So as I said before, diagnosis is usually made. Usually if somebody has symptoms, comes to see us, and then you get a vaginal swab. This one is not normally tested for in the, remember the 4 I told you, gonorrhea, chlamydia, syphilis, and HIV. This is not usually part of the usual sexual health screen. And quite a lot of times, this is picked up after you've been treated for something else and maybe symptoms have not gone. Just bear with me a second. Now, looking under the microscope is not as reliable as it sounds, because the parasites start to die as soon as they're no longer in the body. So, and it also depends on the experience of the person looking under the microscope and how used to diagnosing this infection that they are. So nowadays, a lot of places will use a genetic testing, similar to what we did for COVID PCR you've heard of. And it's also what we do for chlamydia and gonorrhea. In fact, that's where the technology for COVID PCR testing came from. Because even if the trichomonas is dead, the DNA is still present. So if you did need testing in that sense, or if there was a place where they could do PCR, you wouldn't actually need to be examined to get the sample to look under the microscope. You could just do a self-taken swab, or you can send a urine test. The only thing is, though, it can cause issues, the genetic testing, if you're doing it too soon after being treated, because remember what I said, even dead trichomonas will still have DNA present. Okay. So next one, gonorrhea. Gonorrhea is another infection where the rates are continuing to rise. And the number of gonorrhea diagnoses that we had in 2022 was the largest annual number reported since records began. Gonorrhea infection is actually caused by bacteria as well. It's called by a bacteria, sorry, not a parasite, called Neisseria gonorrhea. That might sound familiar to some of who are in the medical field, because it's kind of a cousin to the bacteria called Neisseria meningitidis, which is the one that causes meningitis, and now we get vaccinated and kids get vaccinated against. But gonorrhea can affect nearly all what's called your mucosal sites. So what are your mucosal sites? So we're talking about the P tube. So that's a P tube in a man, a P tube in a woman, the neck of the womb, the back passage or the rectum, the pharynx, the back of the throat. Most men who acquire gonorrhea infection in the P tube will have symptoms. So 90% will have symptoms, and it's only 10% who don't have symptoms. Again, not necessarily specific per se, but they can include pain when you pee, discharge from the penis, testicular pain, prostate pain. And in women, you've got a 50-50 chance of them having symptoms when they acquire this infection. But again, you get similar ones as previously described. So vaginal discharge, pain when passing urine, for example. Throat infections, though, mostly don't cause any symptoms, and it could just be, and if they do, all you'll get is a mild sore throat. Rectal infections, so infections in the bum, can cause discharge, pain when you're passing stools, or blood in the stools. Now, gonorrhea is interesting because although it's a bacteria, like its cousin, it can also spread through the blood. But luckily, so far, it hasn't been shown to cause meningitis. But what it does do is it causes very distinct or abnormal skin lesions that can be painful themselves, joint inflammation, so it gives you a bit like arthritis, but inflammatory type. And then it can also inflame your tendons, which makes it more likely for you to basically snap them or break them. Unfortunately, as the headline that you see there on this page alludes to, it has become very resistant to a lot of antibiotics we have been using over the years to treat it. And so treating people without symptoms for gonorrhea is actually really important. We've often found it difficult to clear gonorrhea from people's throat, and then that means that can be a reservoir of antibiotic-resistant gonorrhea that can be passed on during sexual activity. To diagnose it is super easy. You just take symptoms. If a man has symptoms, it's the easiest thing to diagnose and the least painful, because you just take a sample of the discharge. You don't actually need to go down into the P tube. And then you have a look under the microscope after doing some stains, and it looks a little bit like this picture that you see here. This means that if we see that under the microscope, that person can be treated that very day. Otherwise, you take a vaginal swab, it can be self-taken again, like I said, or a urine sample, and you send it to lab for the genetic testing for the gonorrhea. If the gonorrhea DNA, though, is found, you often would need another swab because it's so important we check which antibiotics it might be resistant to, but we'd give the treatment there at the same time. So often we get the result back later if it is a multi-resistant. So this headline that talks about the super gonorrhea case, I'm happy to say this is very rare, which is why it made headlines last couple of years ago. The current treatment, though, is injection antibiotics. So if you are squeamish or needle phobic, try not to get this infection. This is because, like I said, it's really resistant to most of the other antibiotics that we can give tablets for. But this so-called super gonorrhea strain often means giving multiple injections of antibiotics over a number of days. The last patient I knew of that had been treated for this really super resistant gonorrhea was in 2018, I'm showing my age, and they had to be admitted for intravenous antibiotics that were given multiple times a day over 3 days, and that was the only way to get rid of it. Next one is one that always challenges us in many different ways, both clinicians and patients. And to answer the burning question, no, it's not something that we left in the dark ages. In fact, syphilis is very much with us because the number of syphilis diagnoses in 2022 was the largest annual number reported since 1948. And the challenge of syphilis still remains in its ability to mask so many other, to masquerade, sorry, as so many other different health conditions. And the trend is continually changing in terms of how patients may present and what symptoms they present with. So with syphilis, I feel like we're always on the back foot with this one. What you see here in these diagrams is that what's taught as the classical stages of syphilis, as is taught at medical school and in lectures. But real life can be very, very different. For example, I've presented cases and been involved in treating patients who have been diagnosed with bowel lesions. In fact, one patient was about to undergo a colectomy because it also, the histology, it kind of did fit with bowel cancer, but it wasn't. He was about to have his intestines cut out. And then turns out, so I tested him for syphilis, and it turned out to be syphilis because when we treated the syphilis, it all melted away. He didn't have bowel cancer. I've also diagnosed people with suspected acute hepatitis, like viral hepatitis, and it wasn't. Or another patient recently that they suspected had gallstones, and they couldn't find any gallstones, and were just left stumped going, I don't know what it is. And I did a syphilis test, and it was syphilis because when we treated the syphilis, we scanned him again, and everything melted away again. There was even one recently again that they thought he had pancreatic cancer, so had every scan under the sun and everyone to look for what was causing his abnormalities with his pancreas/liver. And yeah, it turns out it was syphilis. I've also seen cases of people earlier on in my training where they've been diagnosed as having psoriasis. And it turns out that it was all syphilis because when you treat the syphilis, all the psoriasis just melts away. Now, that's not to say everyone who has psoriasis has syphilis, but I'm just saying it can masquerade as so many different things, you know, strokes even. That's another one I've seen quite a few times. Anyway, with all this of what we know of syphilis and how it can present, you would think it was a virus, the way it can wreak havoc anywhere, but it's actually a bacterial infection. It is sexually transmitted and it can be acquired through the vagina, the pee tube, the urethra, or through the mouth, or even through the rectum, through the back passage. It can unfortunately also be transmitted from mother to baby during pregnancy. And the highest risk for this is if it's acquired during pregnancy or just before. It's also associated with an increased risk of miscarriage, both early miscarriage and late miscarriage. So anyway, so how do we test for it? We test on any sore lesions if patients do come in with a sore. And for that one, we obviously look for the DNA fingerprint of of syphilis bacteria called treponema. Otherwise, it's usually a blood test, as lots of people will present between stages where they don't have any symptoms. So between all the different stages, you don't have symptoms. It's called the latent stage when you don't have symptoms. So i.e., or they'll be asymptomatic, or like I said, they can have symptoms that aren't typical. So the blood test will look for the antibodies to the bacteria family called the treponema, as I said. Now, unfortunately, this can cause a bit of confusion in our community, in Black African and Caribbean community, because we may immigrate here, but we may have already been in contact. We are back home in Africa or the Caribbean. We may have been, or even South America, we may be in contact with another treponemal infection. I don't know if you guys have heard of yours, Bigel, Pinta. Those are all treponemal infections, but those are not sexually transmitted and they don't wreak havoc like syphilis does. But what it does do is it gives you antibodies to treponema pallidum bacteria, which they all are a version of. So if that comes up positive, even if you've had treatment for yours, Bigel or Pinta, it will still be positive for the rest of your life. So it's really hard to know, even if it shows like, because the other thing we do is we test for how active the syphilis is. Even if it shows no activity or little activity, it's really hard to know unless you take a really careful history. Has this person had yours, and is this the yours antibodies that I'm seeing, or has this person had syphilis? Or obviously there's nothing to stop you having both, because although you develop antibodies to this and to treponemes, they are not protective. The antibodies, so don't ask me what they do, but they don't stop you getting it again. So the only way we would know is based on the activity level of the syphilis. If you treat somebody, that should come down. So you have to monitor it. So this is one way when you get treated, you also have to go back for follow-up to check that it's actually worked and that the activity level of the syphilis has gone down to what's acceptable level of treatment. Yeah, so if you have had yours, Bigel or Pinta, try and remember, because a lot of people I've come across who have definitely had it even forget themselves, because a lot of times you have it in childhood and it's later on in adulthood somebody's testing you for this. But but usually in the UK, if we're not sure, okay, you would often end up being treated for syphilis anyway, for latent syphilis. Because if there's no clear history, syphilis worldwide is still more common. And remember, like I said, it will do more damage compared to the others. So it's sort of better to treat than not, than to assume. And so I just want to highlight this for you guys. Oh, the QR codes are the links, by the way, to further information if you want to know about the STIs. I forgot to say that. Whilst the majority of syphilis infection in England is in men who have sex with men, we should note that this is not an infection which discriminates. In fact, none of the infections discriminate. But this is one that is definitely highest if you look at this bar in the middle in the 25 to 34 age group in heterosexual men and women. So this is one that probably a lot more people should be paying attention to. So you remember and also don't forget the rise in heterosexual men as well over the age of 50. If you sort of look here, this middle bar, it's definitely going up. It's definitely almost matching the ones 35 to 44. And there is a rise in 65 and over. And so you remember my patient, I said they thought he had pancreatic cancer. He was actually 75 at the time of diagnosis. And obviously pancreatic cancer at that age is also way more common. Now, it's not meant to shock you that 75-year-old men can still have sex, but rather the lesson here is not to judge a book by its cover and think this is not relevant for me because I'm too old or whatever. It is still relevant because these infections don't judge and they don't discriminate. I wanted to touch on herpes. I can't talk about everything I want to know about herpes, but I have to mention herpes, also partly because I'm also the primary care representative on the BASH herpes advisory board. So it'd be remiss if I didn't talk about herpes because it's something as well that we need to work on. Herpes stigma specifically. Herpes stigma, as you see on this slide, is well ingrained in our societies from even BC times. And this is still an issue today because while herpes is something that is manageable and is not as bad as all the other STIs, it still carries more stigma and causes more psychological burden than most of the other STIs, including HIV. And genital herpes infection is caused by two main viruses, herpes simplex type 1 and herpes simplex type 2. In the UK at the moment, the most common cause of genital herpes infection is actually herpes simplex type 1. In America, it's type 2. There is a joke in there, if you can find it. And type 2 used to be the one that was mostly associated with genital lesions traditionally, way, way back when. And type 1 was typically the one associated with lip or oral cold sores. But clearly they can affect both sites equally. And as I said, type 1 is actually overtaken for the #1 cause for lesions on the genitals. Okay. So both of these herpes types can be transmitted during genital contact, oral contact, so kissing, oral genital skin contact. It's a skin to skin transmission. It doesn't require penetration necessarily. Obviously, it's way more likely if the person has an active sore at the time. However, that's not how most people acquire it, because most people acquire it from a partner who themselves don't even know they have herpes or may not have symptoms at the time. So genital herpes infection, as I said, it's the one that carries the worst, the stigma, yet it doesn't have severe complications in terms of affecting fertility or your internal organs. So I put it to you that people affected by lip cold sores who walk around freely without judgment and having to face the same stigma, do not face the same stigma as those who are affected by genital herpes. But yet we're talking about the exact same infection. There's nothing else different. Exact same infection, just at a different site. Now, the good thing, I told you there was good things about genital herpes. So the good thing about genital herpes these days is there's a lot that can be done to reduce the risk of transmission to sexual partners. And there's a lot that can be done to reduce outbreaks as well. And this is by using the medication called acyclovir, or one of its other versions, valacyclovir or famciclovir. And by taking a twice daily dose of acyclovir, which is absolutely safe to do long term, you can do that for the rest of your life if you wish. We now have over 30 years of data saying this is safe, by the way. You can actually effectively then suppress the virus from breaking out in the skin. And this works for both type 1 and 2. So you can reduce the risk of transmission to a partner if you know you have it. And you can also reduce the risk of transmission from mother to baby. And just a little pointer as well, that if you are prescribed something like this long term, it's absolutely free. It's free whether you get it from sexual health, and it's free whether you get it from your GP. They may not know about it, but tell them it's free. Okay. Second one, this was my reminder. Let's just go back. Oh, it doesn't want to now. There we go. And you can see that. So, yes. And then, so you've all haven't all answered that, but a few people have answered that. So most people that did answer had a sexual health screen. So refresh a little bit. Just bear with me. Yeah. Okay. So the next question, because this is what I'm going to talk about next. So just really quickly, if you can, menti.com, use the code 5744027. What do you wash your genital skin with currently? As in what products, if you use any? If you don't use any products and you just use water, just put water. What's free from all sources? No, not genital herpes. Genital herpes treatment. Actually, treatment for any STI, for most STIs, are free from all sources, including GP. But if you needed to go on acyclovir long-term suppression, it should be free. Treatment for HIV is also completely free in this country. Thank goodness. Conservatives might have something to do with that later on, but for now it is. Wipes, water, soap, yeah, emollient. Do we have any more takers? Don't tell me what you think I want to hear, because remember, this is anonymous. I don't know who's answering, and I'm not going to find out. So I don't really, it's just to share, just to get a gauge of where we are in terms of the FemFresh, yeah. We've got, yeah, water and soap, cool. Fabulous, okay. Keep it coming, keep adding, and I'll come back to this, if that's all right with you guys. Keep adding to it, you can keep answering on Menti. So we're just gonna cover the role of genital skincare. So because this is important, and I think this is very important. Again, we don't talk about this, but I always tell people, one thing I always tell people is the anogenital skin, and it is very much anogenital. So this also involves the skin around the bottom end. So the skin around the anus and the skin in the front of the genital as well. All of that skin and the bit in the middle, that's all your anogenital skin. All of that is very much like the skin around your mouth and your eyes. And the inner part of the genitals is very much like the inside of your mouth. And actually, if you think about it, we do sort of use them in a similar way. Just like our mouths, though, our anus and genitals have their own protective army of microorganisms, which, along with our immune system, helps to protect us from infections. Now, although this army of microorganisms are tough when it comes to other bugs, other infections, they succumb easily to certain things that we do in the aim of keeping clean or smelling fresh. When we lack this army, we actually increase our risk of acquiring infections. So doing the right thing by looking after your genital skin is actually a really important thing to do, because you could actually be putting yourself at increased risk of infections and harm than what you think you're doing. Genital skin problems are common, and they could be due to underlying general skin problems such as psoriasis, which is this one here. So this is what psoriasis looks like on black skin. Or eczema, like this is really bad eczema on black skin, on black hands. Or it could be more specific genital skin problems, such as lichen sclerosis. Usually when I do talks like this, I always warn people that you're going to have pictures of genitals, but I tried very, very hard not to today. So I can't show you a picture of a genital lichen sclerosis, because one of the ways that I try to inform people is to actually recognize, hey, that might be what mine looks like. I need to go and get that checked. So I'm sorry about that, but I was trying to keep it completely clean, which is really hard when you talk about sex and genital skin, but I did. So, but you can Google it. Just make sure you put in genital skin lichen sclerosis as opposed to anything else. But one of the really important things are irritants. Irritants, and I've put this irritant because this, for me, is the irritant that I come across with my patients who are of Black ethnicity the most. So irritants, or even having an underlying infection, can cause skin problems, okay? And there are many irritants that can come into contact with the genital skin, which will cause or aggravate the skin problems. And what it is when your skin is inflamed, it is less able to do its job of protecting you from infections. And again, can actually increase your risk of acquiring infections. Remember, we talked about inflammation with Trichomonas. And so some irritants can actually be many washing products that we use, intimate hygiene products. And don't ask me, why do they then exist and why are they marketed? Because somebody needs to make money. Not everything that's on the shelf is good for you. Same thing about cigarettes. Why are they selling them? Somebody needs to make money. Doesn't mean it's good for you. Some sanitary products, even the dyes in some of our clothing or even toilet paper can actually be an irritant. Laundry detergents and fabric softeners. So I've got some tips for what to use and what to avoid. And remember, even if you've used the same product for years and you're thinking, oh, I've used that, I've been fine, I've had no problems. You may have had problems that you've not clicked on, but also the ingredients sometimes also changes, and then that can cause issues. So what's recommended? So this hasn't really done what I wanted it to do, but anyway, don't worry about that. So recommended, I've got some water, absolutely fab if you just want to do water, and water on the outside, not on the inside. When you wash on the inside, even with water, so no shower, so for people with female genitalia, no shower heads up the vagina, please, because that in itself will wash out your bacteria flora. Also, the vagina is self-cleaning. Everything drains outwards. So you don't need to be putting anything up there to clean it out, okay? But yeah, water on the outside and under the foreskin and in between folds, between the vulval folds, absolutely fine. Emollients like Zeroderm, and there's lots of other emollient washes. These were supposed to stack, but don't worry about it. And there's lots of other ones that you can get now that are actually quite good. Now, emollients are a good idea. Emollient substances, because they can actually help moisturize, soothe, and heal the skin. And they're usually a good idea if you already have a bit of skin inflammation. It is recommended to wash your genital skin daily, but alternate days is also acceptable if you're unable to, but more or less often than that can actually cause problems More than twice a day would cause problems, I would say. And warm water. Nobody likes the cold water on their genitals. It's very shocking, isn't it? I would say avoid scented soaps and shower gels. I'm looking at the men. And yes, those of you who use Lynx shower gel, so especially you wash it everywhere and just Lynx is number one. What I hear in my clinic when people come in with skin issues, Lynx shower gel. So I'm sorry, I'm not picking out on any brands, but it is what people tell me. And then the ladies, I'm looking at you with Dove shower gel. And then for both men and women, for both those with male and female genitalia, Radox. Don't ask me what it is about them, but they are not, just don't put them near your genitals. Enjoy Dove, enjoy Lynx, just don't rub your genitals with them. Because the fragrances and preservatives is what can cause irritation to your already very delicate genital skin. Now, if you're using a cloth or sponge, which is very rife in our communities as well, careful because they can be quite rough. Even a flannel or a washcloth, as we call it, that can actually damage the skin. And then when you finish washing, just pat the skin dry. You don't need to, I see people doing that with the towel, don't they? Just pat it dry gently. Remember, this is a delicate piece of skin. Pat it dry, and that includes the folds of the vulva and under the foreskin. Just pat. And if you are prone to genital symptoms after sex, it may help to wash and dry your genital skin shortly after sex. It doesn't have to be like straight away, but shortly after. Not recommended. I wouldn't recommend Femfresh. Oh, that's flipped around, but yeah. Vagisil, feminine washes. This is from, I think, B&M or something. Canny Fresh. All of these not recommended, and they're not going to help your genital skin. So save your money. You're already paying for this. Or this is much cheaper because you can get a big tub like this that will last you months and months and months. And it's only a £5, and this is like £1 or £2 already. So save your money. So see, I'm here to save you money as well as your genitals. Right, I know I'm running a bit behind, so I might get told off in a minute, but I do need to talk about HIV. I know. But we can't do this without talking about HIV. That would be very, very amiss. Okay. So there's another Menti. Quickly, really quickly, if you can. We've done that one. We've got lots of responses, mostly water, that's good. Have you ever had HIV tests? Cool, how will you do that? And I'll look at these, by the way. So, why is HIV exciting? No, it's not the number of people. But when we look at HIV in the UK, we know that over 101,000 people in the UK are living with HIV infection, with the majority of those being diagnosed. Okay. However, we know that that means a significant amount still remain undiagnosed. Yes, that means that there are people living. That means that there are people living with HIV infection who are unaware of this infection. So, although the majority of those people living in the UK are white and male overall, I think you'll agree. Where is it gone? Yeah. Okay. When we look at heterosexuals, the significant majority are Black African. We also know that 1 in 3 people diagnosed with HIV are aged over 50. And this is kind of a mix of newly diagnosed people aged over the age of 50, as in diagnosed late in life, or acquired the infection late in life. But also we've got a growing group of successfully aging cohort of people diagnosed much earlier, people who took treatment, particularly when treatment even diagnosed since the 80s, and who can now look forward to their older years. I did want to just mention one thing really quickly. When we look specifically at those who are Muslim, because we have this data, by the way, we know that 54% of Muslims living with HIV, again, are mostly Black African. If we just look at women, so i.e., what proportion of Muslim women living with HIV are Black African, this rises to 79%. So my sisters, in every sense of the word, my Muslim, my Black sisters are the majority of carrying the heavy burden of HIV of the Black African community, particularly if they are if you then limit it to just Muslims. But the great thing about HIV is you need to tell everybody is HIV has changed. The stigma remains, but you know what? We actually, and that seems to be the main issue of why we can't end HIV transmissions. Because the rest of it has changed, and it's changed for so long now that even I think I was still a junior doctor. Basically, people living with HIV now have a normal life expectancy. Why? Because U equals U. If you are diagnosed with HIV and you're on treatment, effective treatment, and you have an undetectable viral load for 6 months or longer, you are non-infectious, not lower risk of infection, zero risk of infection. And I'm going down in recording saying that. Zero risk if those three things are fulfilled. U does equal U, and there has not been any transmission of HIV from someone being undetectable. Which means the transmission are being driven, and we see this a lot because when we diagnose patients, we do what's called a contact tracing. So we ask who they've been with or who they've had. We ask about their sexual partners, and when we test those people, they weren't aware they had HIV infection. Why? Because they had no symptoms. I've been one all my life. The other good thing about diagnosing HIV is actually, if you live in the right area, you can actually have a better life expectancy than if you didn't have HIV. So really, getting tests of HIV is one of the best things anyone can do, regardless of what the result is, because yes, it can be life-changing, but in such a positive way. So hopefully you guys know some of the ways HIV is passed on, but I'll just cover them quickly. Sex without using a condom, sharing injecting equipment or only blood-to-blood contact. A mother who's living with untreated HIV can also pass on to her baby, but a treated mother cannot. And I'm so honored to have been part of so many HIV positive pregnant women's journeys to delivering HIV negative babies. One of my patients who has the highest amount of HIV negative babies since diagnosis, she has had 8 pregnancies and delivered 8 HIV negative babies since I have known her. And it is an honor to be part of that person's journey. HIV cannot be passed on through sex without a condom. Remember what I said, if the person living with HIV is on effective treatment. Or the other thing is, if the person knows they're HIV negative, they can also take PrEP. But it can definitely not be passed on through kissing. Very difficult to pass it on through oral sex, and that's still never been proven. Licking, sharing cutleries or mugs, or sharing toothbrush, or living in a house with somebody with HIV doesn't get passed on that way. So we do really need to work hard on ending this discrimination, because I feel that's harming us as well. Right, I'm just going to move this because, again, this hasn't really. So, as I already mentioned, HIV, knowing your status is really good, because knowing earlier means you can start treatment early. Testing can actually save lives, because you can only start treatment if you know that you are living with HIV. And actually, worldwide, the number is quite scary. 9.4 million people worldwide don't know they have it. I know somebody's going to ask me later on, so how do we know they have it? I'll come to that later, if somebody asks me. If not, please forget I even mentioned that, because I don't want to go into that. And negative HIV result is also beneficial because it gives you access to the range of HIV prevention options that are available to keep you and people you love HIV negative. Testing also means that you can actually reduce the risk of transmission to sexual partners. Remember, I'm going to say it again because this is the most important thing if I want you to remember anything. With effective treatment of HIV and an undetectable viral load, the risk of transmission literally goes down to 0. It's empowering to get tested because it means that you're actually making decisions about your health, and it's empowering even when you do know you're negative. You have it in black and white. You don't just think you're negative because you're like, no, I don't have that. You actually know, and you'd be like, yes, you can say it for certain. I am negative when you're negative. And if you're positive, there's so much you can do, and your life is going to be so much better. You're going to be well looked after. Lastly, this big slide I've put in the middle, because that's the really important one. It gives you, remember I said about the better life expectancy for some people living with HIV in some areas? That's because they get screened more frequently for other health conditions, and it gets picked up quickly than if they did not have HIV, even though it's not symptoms. So things like even high blood pressure, diabetes, because they get screened and they get their health checked literally every year. And there is capacity to do so because they're in contact with their HIV specialist care provider. And usually if they've got a good GP as well, who knows to do that. Women get an annual cervical screen to reduce cervical cancer. So cervical cancer is something that is really coming down in terms of the rates in women who are diagnosed with HIV compared to the general population, where the rates are still about stayed stagnant. So actually, it can be a good thing for your health. You can actually live longer. So lastly, where can you go for sexual health help? Well, there's the sexual health clinic, which I don't see many of you guys there, I have to say, very sadly. I don't see many of my Black brothers and sisters there, and I'd love to, because things, if you go to a specialist sexual health clinic, it's completely separate from your GP, it's free, it's confidential. We don't even care if you use a false name. Just remember which name and which date of birth you gave us so that it can actually match next time, so we can find you, and so that you actually have your whole records as well. We have access to your previous records. That's all we ask. But literally, you can use a false name. I mean, people used to do that back in the day, but you still can. You can use a false name. You can give a different date of birth if you want. If that makes you feel better, if that makes you feel more secure, but it is completely separate from any, and is protected by law. The confidentiality is protected by law. And there you can have testing and treatment for HIV and STIs. And there are some things you can't go anywhere else because it's a specialist service, obviously. And we can also give you what's called HIV pre-exposure prophylaxis. So that's where you take 1 tablet a day to reduce if you're someone who's deemed at high risk of acquiring HIV infection from detailed question with you. You can have 1 tablet a day, or 1 tablet around the time you plan to have sex, where it can reduce your risk of acquiring HIV. And again, this has been shown to be more effective than even condoms. We also have lots of online self-sampling nowadays that's from sexual health clinics. So again, you don't need to necessarily go in case you don't want to be seen to be going somewhere like that. You know, I sort of get, in our department, we have, and I don't think it's helpful, but we have like a blackout, we blacked out the glass in the door. And I often, when I come out of our little bit of the health center where our department is, I often do see, and I come and get coffee and I'm at the cafe, I often see people do this before they push the door open, sort of look over both shoulders. So if you do feel that way, online self-sampling is good for you, but so not everything we can do through that. So if you do need treatment, even if you self-sampled and it was positive, you'd still have to come in and get treated. Obviously GP surgeries, because we are building better general practice and we're trying very hard. And I'm definitely one of those people who's trying to drag sexual health and drag my GP colleagues towards delivering a better sexual health service as per their contract. Can I just say it is in the general medical services contract for GP. And also you can have a look on the website for British Association of Sexual Health and HIV, and obviously the NHS website, which is fantastic. And my absolute last plug, next week, it's as if we've planned this. Next week is HIV testing week. It's the National HIV Testing Week, where we try to get people testing. Even if you've tested before, test during this week. Often tests are more widely available from more non-traditional sources. But I would like to encourage you in National HIV Testing Week to know your status, because all of us have a HIV status at any point in time, whether it be negative or positive, but know your status, not your partner's status, not your wife's status, not your kid's status. Know your status. Your blood sample is your test. Someone else's results cannot be your test. That's their test. And remember what I said, because there's no infection that is 100% transmissible. So you can't infer that, oh, but my partner's been testing, we've had like 5 kids, and if it's a female, and she's had like all the kids and she's had it when she's pregnant and she's negative. I've seen it way too many times. I still have patients who are what we call serodiscordant. They've been together all their life, there've been no external anything. One is positive, the other one's negative. I've also had patients who've acquired it. More recently, I diagnosed a 17 and an 18-year-old the first time they had sex. They were each other's first sexual partners. And guess how we diagnosed the 18-year-old? Because the 17-year-old had seroconversion illness and had a random test, even though nobody picked up that she was having HIV seroconversion. But literally, they had their first sexual encounter. And then when we tested him, he's had HIV since birth. He didn't know about it. And we know he's had it since birth because, well, just the way his immune system was. And then we ended up finding out his mum was actually one of our patients. Anywho, that's another one for another day. So I will stop talking. I will leave you with some QR codes because we haven't covered these infections, but I do think you do need to go find out about them. Chlamydia, very similar to gonorrhea. There is a screening program that exists for under 25, but again, it can also be found in the throat and it doesn't discriminate. Genital warts is another chronic one, which tends to affect people's mental health and carries a lot of stigma as well. But we are starting to see the positive effect of HPV vaccine. But again, skin-to-skin contact is an important mode of transmission for this one. Scabies, it still gets missed, even though I'm still not sure if scabies should really be classed as an STI. It's because it's spread by close contact, especially when you have like outbreaks in nursing homes and things. So I'm a bit like dubious about calling it an STI, but it still comes under what I've been trained to treat and recognize. Pubic lice, we're seeing less and less of this. And in fact, the younger sexual health clinicians being trained nowadays are not even being examined on this because it's so rare. And why are we seeing less of it? Because we're also seeing less and less pubic hair. And that now is the new normal. So unfortunately, that means it's more likely to be missed because the clinicians that are coming through now are going to be de-skilled in identifying it. LGV, you can do a whole degree on LGV. It was initially thought to be a relative of syphilis, but actually it's a relative of chlamydia, and it wreaks havoc though, like syphilis does. And it's mostly in men who have sex with men, but you can find it in heterosexuals. You don't need to have anal sex to get it, but it does prefer the rectal mucosa. And that's me. I'm sorry that I rushed it at the end and I'm trying to breathe, but hopefully that was useful.
Thank you so much, Dr. Lebari, for that talk. I thought it was really useful and really interesting as well. We do have quite a lot of questions to go through. So is it all right if we get started?
Yes, let's get started with the questions. Hit me. I might not, and if I can't answer it,
And apart from that, if anyone... Go on.
No, I was just going to say, if I don't, if I can't answer it, don't worry, I'll try and find you an answer later, or I will, email you or something.
Well, okay. And if anyone's got any other questions that they'd like to speak up about, just put your hand up and we can ask you to speak. So our first question that we've got here, okay, let me just get that up. Okay, 1 second. Okay, first question here is, pregnant ladies receive numerous tests throughout the pregnancy. Is any of them STI, STD, or HIV tests?
Yes. I think I sort of partially answered this when we were doing the Minty, but yes, so pregnant women get what we call blood-borne virus screening. So they receive screening for hepatitis B, HIV, and syphilis. But you only get offered an STI screen. Remember what I said before, STI, a sexual health screening involves minimum four, chlamydia, gonorrhea, syphilis, and HIV. So you've got the syphilis and the HIV there for pretty much all pregnant women. They're offered, by the way. Doesn't mean you have to do it because women do decline. And I'll come back to women who decline in a minute. If I forget, tell me, because I do talk too much. But chlamydia and gonorrhea is not usually routinely offered unless you're under 25 and pregnant, because they're doing it as part of the chlamydia screening program. And even then, it's often only chlamydia, but they'll often do, the labs often just test gonorrhea because it's the same platform. Women who decline blood-borne virus screening, are way more likely to be Black. I'm looking at you, sisters. And way more likely to have one of the blood-borne virus infections that they're declining screening for. So usually for women decline screening, she is supposed to then be offered it again repeatedly later on in pregnancy, because it's not really for you, it's for the health of your baby. And so knowing earlier is actually better. Even if someone is HIV positive woman is pregnant, the earlier she starts treatment, the better it is, because the more time she has to become undetectable and the less chance she has to pass it to baby if she becomes undetectable. In fact, it's impossible. And a woman who's pregnant with HIV and on treatment and undetectable can have a vaginal delivery. It doesn't mean you have a cesarean section. So everything becomes normal if you know your HIV status. Literally everything becomes normal. You can even be, although it's not recommended here because there's alternatives, you can even be supported towards breastfeeding. And now there's a whole guideline about it. So because I know in our culture, and when I've spoken to other women that I've diagnosed, remember, it's mostly Black African women I have on my list who are women who are HIV positive. One of the things that puts them off even getting pregnant in the first place is the fact that, oh, well, my mum doesn't know I have HIV, or my family don't know. So if I have kids, I don't want to have kids because then they'll ask me why I'm not breastfeeding, because that's another pressure in our community, and actually they can be supported to breastfeed now. So nearly everything is normal. You can be supported to breastfeed safely. Nobody needs to know. And you can just be healthier and your baby's healthier. Why would you not want that for your child?
Yeah, that's right. Yeah. Okay. Just wanted to clarify. So there's those 4. So is it because you have only had 3?
You only have 2, don't you? The HIV and the syphilis. So this
Yeah.
will count as a sexual health screen. You've been
Okay.
screened for the blood tests.
Okay. Our next question here is: does Trichomonas vaginalis cause infertility in humans?
That's a good question. The data does not suggest so, but the way I think about it is most STIs tend to cause issues with fertility if you've got a STI on board through making a more inflamed genitalia, inflamed womb. And what we do have evidence for, and we have evidence from other conditions like endometriosis about this, is that an inflamed womb is less likely to carry a successful pregnancy. Okay. And also, if you think about where trichomonas affects as well, even in men, if it can affect the testicles and cause pain, and that means inflammation, which means scarring, which means that's damage to testicles, and those tubes are not going to work as well. So the sperm's not going to travel easily because now you've got scarred tubes that might be a bit tighter, so we can't prove it because the study's not been done. I wish people would do the study. And one of the big reasons I feel that trichomonas is, we've done so much research in the last 20 years that I've been in sexual health on every other STI except trichomonas. And the reason I feel is because we aren't the one doing the research. The people doing the research aren't affected by trichomonas, so it's not a priority. So if somebody wants to do the research, I'd be happy to, but I would postulate, because we see it with the other STIs, that when you've got inflammation on board, which trichomonas definitely causes, and it causes a lot of inflammation actually, that you don't see, it will affect fertility.
Okay. All right. Just question, was the trichomonas one that you mentioned that it's quite common in Black people?
It
as
is
well?
almost exclusively seen in Black people, and when you see it in non-Black people, you can link them to a Black person.
Okay, so that might be linked to why we're not getting those
That's
studies
why.
done.
Who's doing the research?
Yeah. Okay. Fair enough. Okay, we've got our third question. Do you think that faith networks have a role to play in making the community members they lead aware of the dangers of STIs?
Yes and no. I think, okay, this is just a personal opinion. I'm just going to put this out there. I think we've done wrong by our community, because yes, I know we go to our faith leaders for a lot of things. I wasn't born Muslim, by the way. I was Christian before, and we did go to our pastor or our priest for lots of things when I was Christian in my family. And so, like, growing up, I'm not sure if they're the right people to go for this, which is why, and I think we've put pressure on them, number one, which is where we're now having to be on the back foot, because we put pressure on them. And I'm sorry to say this, but especially people of Black African ethnicity that I've come across, especially, dare I say, because I am half Nigerians, we never seem to say, we don't know the words, I don't know. We don't. And we never know the words, I don't know, I can't help you, that's not my thing, I don't know. We never say that. And that's a bad thing, because what we did then do is we went to our faith leaders going, hey, you should know about this, tell me about this, tell me. They didn't know. And what did they do? They filled it in with what they did know. And so, or some of them did, not all of them. So now what we have is, what's rife is people going, oh, but my pastor healed me. And this is quite relevant, especially when it comes to HIV. They don't know how HIV works, and they'll tell you, stop taking your medications. They don't know how the medications work. So, and now we're on the back foot. So do faith leaders have a role? Yes, in signposting you to the right people, but not on taking on the role of, they are faith leaders. They are there for your faith. They're not there for your health and well-being. That's your responsibility, to seek the right information from the right people. And their role is to signpost you to the right people for when they don't know. And if they do know, to share the information they do have that is reliable.
Yeah. Okay.
That you won't come to harm from.
Okay. And would they be signposting particularly back to like clinicians and like
STI? Back to
Yeah.
sexual health, back to people who know, back to lots of people who are doing lots of advocacy work with regards to sexual health and sharing information that is evidence-based.
Yeah. Okay. Brilliant. And is there any like websites or sources where we could find direct links to them?
I'm glad you said that. Haha. It's like I knew you were going to say that. There you go.
See. Well, okay, so we've got some links there. So, is there any way we can get these?
Have a look at Bash. Bash has lots of leaflets that we worked very hard to produce.
Okay.
UNAIDS, if you want the more sort of worldly view, but they tend to focus a lot on sort of HIV in Africa and sub-Saharan Africa and the Americas. But obviously NHS UK.
Brilliant. So we've got those different links that we could go to. So we've got Bash. I don't know if we can get them in the group in the chat at all.
Oh yeah.
I'll just quickly move on to our next question. What is the best product to use as a lady to clean your genitals when you visit the bathroom?
Emollients. Water's actually the best. Water just on the outside. And for any other Muslims who are on the call or on the meeting, you guys will know, like religiously, we use water after every wee. Okay, so after every bowel movement or passing urine, you use water. And there's goodness in that. So just water is fine. I know some people go, oh, but I don't feel clean because something hasn't rubbed there. I'm like, and again, I'm going to tell you this: vagina self-cleaning, it all comes out. So what you are washing away with water is literally just what's come out of the vagina anyway. So, and that will go away with water very easily. Like I said, because if you put water up it, it damages it. So no douching in the vagina, no douching in the rectum, either the back passage, because that also has its own army of microorganisms to protect you. So yeah, and if you do need to use anything, just any of the emollient washes are fine. Again, just on the outside, never on the inside. Nothing on the inside. And sorry to be crude, but just to drive the message home, I always say nothing on the inside of your vagina, if you have one, unless a penis or a dildo. Those are the only two things that should go there, or anything that you consider a dildo.
Well, okay. So we know emollients, don't put stuff up there unless it's, what was that, a dildo?
Or a penis.
And I know you mentioned that sometimes you have to fill a certain criteria. Is there anything like really specific that we could look out for?
So
if we want to know
okay, so the guidelines say if you want PrEP, well, it depends also what your sex life is at that moment in time as well. So it depends, like, based on the past, the future, / like if you have a recent partner change, if your partners are who are deemed at higher risk of having HIV, like so actually a Black African woman should get PrEP, should she want one. Same as same as a man who has sex with men.
Okay, so those are key things that we could look out for there. And we've got another couple of questions coming through. One, how accessible is screening? Can you get kits sent to private locations? We know in the Black community there is so much stigma.
Yes, so because the stigma, do you remember I said about the people checking over their shoulder when they come to my clinic? And I always go out for a coffee because I'm a coffee fiend, and usually I can't survive till 11 without a coffee. So I always like proper coffee, not freeze-dried stuff. Sorry. I'm not snotty at all, but even when I'm broke, I will always have a bought coffee. Anyway, so
real coffee.
Yeah. So I always see people when they're sort of coming, if I'm in between patients, and then we'll just sort of do this before they go in. And so people do that. So there's online kits available that you can request from a lot of sexual health clinics. Unfortunately, it isn't available everywhere because of the way, dare I say in this country again, bureaucracy, but the way things are funded for certain localities. So for example, SH24, if you're in London, has a very good provision for like the London area and maybe just outside. So if you look up your local sexual health clinic, though, they will have a website and they'll say if they've got online testing. We do. So I work actually as a consultant in Blackpool, even though I live in Cumbria, and that's where I do my GPing because I'm crazy and I like driving 2 hours on the motorway. So I work in Blackpool as a consultant in sexual health and then do a bit more sexual health than GP here in Cumbria. And Cumbria has had some online testing kits. It's not perfect, but it's touch and go. We're limited. But Blackpool, we have loads. We send them out to you. Again, use whatever name you want, even on the online testing kit. Send it to whatever address you want. It doesn't have to be your address because you don't need to confirm any address. Just as long as you receive it and you do it and you send it back to us, which is free, by the way. You just literally stick it in the post. So you don't have to pay anything. And it fits in the post box. So yeah, You can send it to a private address. You can send it to a hotel address if you want. Do your test, get out the hotel, bish, bash, bosh. Oh, Kemi, I've lost you.
Yeah, we seem to be having some technical issues. Hopefully, Dr. Campbell will be with us shortly.
I'll go with the questions I can see in the chat then. Babies are always cleaned up with a product like baby wipes. Yeah, that's fine. Do you think adults can also use it after visiting the bathroom if you don't feel comfortable with water? But then I'd want to explore, why don't you feel comfortable with water? Most of those baby wipes now anyway, remember, are moving towards being water-based anyway. And, you know, that's kind of how they're selling it, because the ones before that they used to sell when I had my first child 7 years ago had too many preservatives and irritants in them. So, you know, you'll find most of them now say, oh, 99% water, plastic free, etc. So I would say if you're going to use baby wipes, isn't that still water? But if you don't feel comfortable with water, I don't know. I mean, yeah, if you want, but I would still say you probably need water, because then you need to wash it off any irritation that can happen or any irritants you might get. So you need it to not be in continuous contact with your skin. Try water, you'll love it. Just try warm water. I mean, we're having some douches fitted because we've moved house. You know, the toilet douches, which is now the fad. So the cost of them has gone up. When we were getting it the first time around, it was cheap as chips. But anyway, and we're having some fitted, but we always run it through the warm pipe so that it warms up when you put it on. Pamela says, or not Pamela, but just somebody's asked, given the high rates of STIs, how do sexual health providers work with the Black community to engage them in sexual health prevention? Well, doing talks like this to you guys. I got into sexual health because I saw who needed it the most. If you're Black, if you're Muslim usually, and I felt comfortable talking about it because I talk about it like another part of the body, the same way you would talk about breast screening, the same way we talk about everything else, the same way we talk about our arms, our diabetes, or my leg hurts. It's the sort of I don't want to talk about sex and sexual and genitals. We all have it. We literally all have it. If you have kids, you've had sex. Everybody knows you've had sex because you've got kids. That's the evidence. I don't know what you're hiding from. Anyway, so talk about it more and engage with places like, with organizations like Khan. And there is so many Black people that need to hear this. Spread it around, tell your friends, tell your neighbors, even if you think they know, start talking about it the way we talk about everything else. What happens in Blackpool stays in Blackpool very much. Can men have or request HPV testing if their partners with services test positive after a smear test? No. So the reason for that is there's a lot of HPV, and the one that's found on cervix when you have your smear is the high-risk HPV that they're testing for, the one that can cause cervical cancer. So if a man has it, yes, it can also cause other cancers. So HPV is actually more than cervical cancer. It's penile cancer, throat cancer, tongue cancer, anal cancer. What else? Basically all the stuff, yeah. All the places I talked about, mucosal surfaces. And the reason why we don't test the partners is because what do we do with it? Because even the woman, we can't clear your HPV. We can treat you once it's causing problems. So we can treat the changes of HPV. So if a woman has HPV on her smear, she just hasn't, and she has no changes, she just has another smear in a year time to see if it's causing any problems. So that's why, and also a lot of people clear HPV. So I will shut up because now we need to apparently talk. We need to get rid of me.
Yes. I was going to ask Dr. Dornub, first of all, thank you so much for for this talk. Incredibly, just opening up about so many items that in our community we just don't want to talk about sexual health and just closing our eyes. And you're absolutely right. It's something that we gotta just need to bring the conversation to our homes, to our loved ones, even workspaces. Why not? So I've actually signed up for the test I just said, let me just do it. Free testing. I'm all for that. So please do get yourself tested if you can on National HIV Test Week. Sorry if I got the name wrong. Doctor, is there anything, a last thing that you'd like to leave us with before I pass it on to my colleague June?
No, but please talk about it. Talk about it with your kids as well when they're coming of age. Only you as a parent knows when is the right time. Don't just leave it to the schools and stop fighting the schools. It's kind of your job in the first place. So if the schools want to do something, fine, leave them. But you set the tone first. You know your kids better. And I really just hope and pray our next generation of Black people are more empowered in sexual health. Because you know what? We have conquered so much as Black people. So much. Let's conquer this because we are letting ourselves down.
Well, after the stats that you shared, we really understand that we are letting ourselves down, and there is tools out there to help us. So I wanted now to thank you so much. We already have people in the chat asking you for you to come back. So there's no better feedback than that. And I wanted to thank you again for coming, and thank Dr. Kemi for hosting. And also we hope that you're back. I wanted to pass to my colleague June. She will be doing the closing for us.
June, you're muted. Oh, sorry, June, you're still muted. We can't hear you.
Sorry, June, you appear to still be muted. Are you able to unmute yourself? Is it not working?
Hi, can you hear me now?
Yes, we can.
Yes.
Thankfully. Thanks, June.
Yeah. Oh, I'm so sorry. I was talking away and I thought everybody could hear me. Then I realized it wasn't. So I'll just go through this. Sorry, now I've lost my slides. Won't be a minute. Has anybody else has got the closing slides?
Yes, I do. I can share on your behalf.
Please do that. Sorry. Thank you, Natasha.
And we tested it as we always do. And
I know it was the mute bit. I was
Yeah.
everything else except the mute bit that threw me. Thank you. Okay, just a few reminders of what we do, the wonderful work we do at Calm. So as you know, every Saturday, our next CAT tip meeting will be next Saturday, the 10th of February, 11 till 12:15. And the health hour session will take place again next week. Tune in to benefit from the expertise of our Black doctors. And this is where you can register or email or just visit us. Thank you very much. Next one. Okay, so on Tuesday, the 6th of February, every Tuesday, 6:30 till 8. The topic this week is during our Healthy Heart session with our diets and physical activity. And the next session will be about, should we consider the carnivore diet? Your host is Dr. Hibber, and she's a registered nutritionist. And our guest speaker, Dr. Evans, and our physical instructor, Orlando, will be at the end to take you through your paces. That's a very interesting, very topical subject. Next slide. Thank you. Victims Voice Panel. So join us in celebrating the Victims Voice Panel, and the voice is in collaboration with LOVE. And it's going to be on the 14th of February, Valentine's Day, at 4 o'clock at 1600 hours. Keynote speaker is Kate Green, who's a deputy mayor of Greater Manchester. And you can engage in discussions, get service updates, enjoy quizzes and network. It's a Valentine's Day special. And there's the email to register. It's advocacy@carn.org.uk, or you can scan the QR code above to visit. That'll be an interesting evening. Get involved with Homes for Health. Let's make private housing conditions in Gorton better. Are you renting from a private landlord or agency? Are you Black, Caribbean or African living in Gorton? Do you want to make your voice heard and support other tenants? If the answer is yes to any of the above, join us. And the registration is now open. The same, scan the QR code above or take part in that phone number. Okay, thank you. Why are Black women 4 times more likely to die during pregnancy? And how can we bring these issues to the forefront of the UK public health priorities? Not just bring it to the forefront, but keep it at the forefront. Join us at the Black Women's Perinatal and Infant Mental Health webinar, which is going to be on Friday, the 9th of February, this Friday coming at this year. Register now. So it's going to be at 2 o'clock till 3:30, and it's really important. Just join in, find out what's going on. Free English classes, join Creative English and they are free. Learn to communicate with your doctor, build confidence and understand family health. Classes are free in Stockport for 18+ residents. You don't have to live in Stockport, they're just going to be based there. And there's the details of how to register, the links there, or who to text and call. Thank you. How's your lung health? Are you current or former smoker between age 55 and 74, living in Barnet, Camden, Enfield? This is for the Southerners, Harry and Kay or Islington. Take control of your lung health today. Look out for your invite, have a free painless lung health check. And then there's a link to, or the QR code, scan the QR code and get your invite, have a free invite and have a free painless lung health check. Okay. Thank you for joining us today, and we hope to see you all next week. Thank you very much.
Welcome to our Caribbean and African Targeted Health Improvement Program, CTIP Health Hour. Caribbean Health Plan, along with the regional plans, by Caribbean and African. These are all about and space Black people, communities can look after themselves better. Every Saturday, our Black GPs present on those health and well-being topics that affect you, your family members and friends. Some weeks will vary and will include other panel members such as pharmacists, specialist nurses and faith leaders. Our health hours cover a range of topics and include mental health, heart health, women's health, reproductive and sexual health issues, men's health, respiratory problems, cancer, sickle cell and many more. We have not forgotten to include within our health hours the many societal, cultural, religious and racial challenges that can go hand in hand with health problems and influence how we should respond to meet health and well-being needs. The sessions are designed for you, and we want you to use the time to listen, learn, share your experiences and ask questions to our Black doctors. During every session, we will gather your feedback so we can continue to respond to the needs of our Black community. To request any particular topic, please email health@carn.org.uk. We encourage you to invite others to our health hour sessions. Spread the word in our community. CATHIP is funded by the National Lottery Community Fund.